Alrighty, hello everybody. Welcome to another session with dental shadowing. Today we have Dr. Kotak with us. She is a pediatric dental resident and she's coming here to talk to us a little bit about Temple University Hospital, her experience in dentistry. So thank you so much, Dr. Kotak, for coming today, and we really appreciate it.
Thank you for having me. I guess I'm actually quite excited about this talk today. I'm assuming a lot of the viewers are either undergrad students, university, high school. I'm not sure what the audience is, but I'm assuming that nobody really is deep into dentistry. So I'm going to keep the language pretty layman so we can have a conversation. And if at any point you have questions, you can put it in the chat box and I will get to it probably at the end. So a little bit about me. I am a pediatric dental resident at Temple University Hospital in Philadelphia. I am in the first year of my residency program. It's a 2-year program. But before I kind of, get into that, I just want to give you a little gist of my life because it's kind of hard to understand where I am in dentistry right now. So I did graduate from dental school. It's been a long time now, almost 10 years. And I did practice as a general dentist. I did some advanced dentistry programs in Colorado. And then I came back to school, technically working at a hospital for my pediatric dental residency. But I'm going to break it down in detail and kind of explain to you the path that I took. Each one of you is probably going to follow a very different path. You will realize there's just not one straightforward way of doing dentistry. But I'm excited to talk to you about the path that I followed. We can go to the next slide. All right, so a little bit about me. I grew up in India, and that was where I initially attended dental school. I then moved to Colorado and did my advanced standing program. So I got my DDS, and that was in 2014. I then went and practiced in Dubai for a couple of years. In the middle of it all, I went and practiced in Kenya, and now I'm in Philadelphia. So as far as my education goes, like I said, my initial Bachelor of Dental Surgery was from Manipal University in India. It was in 2011. You can see that it's a pretty, swanky looking building for way back in the day and in India. And what this dental school does is it's not only for Indian dentists, they accept a large number of international dentists. So I actually went there from Dubai, and I had a lot of, classmates who came from Canada or, other parts of North America, because you do not have to follow the traditional journey of, going your 4 years of undergrad, 4 years of dental school. There's other ways of doing it, and that's the one that I did. Of course, this was just where life took me, but I hope that you find what works best for you. Fast forward a couple of years, once I graduated, I decided that it was actually during my internship year from India that I did an exchange program at USC, Southern California, and I spent 2 weeks with the dental students in LA, and I realized that I really wanted to see what North America had to offer in terms of dentistry, lifestyle, and that's when I started applying for dental schools in the United States. How it works for any foreign trained dentist is that they have to take their national board exams. There's 2 parts to it. Once you've taken those, there are certain international dentist programs, which essentially is a 2-year conversion degree, or 3 years in some schools, which converts any foreign dental degree into an American DDS. So while most of you will follow 4 years of pre-dental, 4 years of dental school, that's 8 years. I think the timeline for me came up to about the same, because I went to, straight out of high school, I went to 5 years of dental school in India, which kind of combined the pre-dental and dental. I spent about a year, shadowing at offices, taking my board exams, and then 2 years. And then I graduated from University of Colorado in 2014 with a DDS. And we can move to the next slide. And now, after taking some time to practice, I guess I realized that I really wanted to specialize. Majority of dentists will practice as general dentists, and I did as well for about 5 years. It is a very fulfilling job. There's so much you can do in the scope of general dentistry. It's just that I happen to work at offices which were primarily focusing on children. And I guess part of me realized that I was, you know, getting better and better at it. And there was also a lot of children and cases that were beyond my scope, and I had to refer them all the time. And I really wanted to be able to serve them. And that's when I decided that I wanted to go back. So I applied for residency. The way residency works is, it's something called match. You apply to a bunch of programs, you go for interviews, and then based on the schools that you interview at, you rank them in order of which ones you like the most or which ones you see yourself fitting in the most. The schools that interview candidates will rank the candidates, and then there's a date, usually end of January of every year, where an online match happens. There's an algorithm that will match you to a school, hopefully of your choice, or in the uppermost part of your list. So that's how I ended up at Temple. It is, according to me, a phenomenal program. I will talk to you more about it in just a little bit, but we'll move to the next slide. All right, so this is where my life, I guess, gets a little different. I did talk to you about India and Dubai and UAE and the United States. So I actually practiced in quite a few countries already. It's not the norm. It's not what I had planned out to do when I started, but that's just how life worked out for me, and I wouldn't have it any other way. I think you learn so much from your experiences of traveling and even in dentistry. So I like to always kind of present that, does dentistry change across borders? Or is it just the same whether you're practicing in India, Dubai, Kenya, Philadelphia? And I'm going to go deeper into that. So we'll move to the next slide. All right, so I'm going to talk to you about my most recent working experience, which was in United Arab Emirates. The city is Dubai that I lived in. I practiced there as a general dentist for about 3.5 years. I will tell you that life in Dubai is very different. No place is perfect. And Dubai definitely has its positives and negatives, but it's a really wonderful place. I spent a few years there. And the focus, though, dentistry-wise, there a lot was on aesthetics. People want to have veneers, people want to have whitening, people want to have a beautiful smile. Here in the United States, usually when most of you, if you've been recently for your dental exam or checkup with your dentist, you're going to have, x-rays taken, you're going to have a cleaning done. Based on your x-rays, your dentist is going to recommend that you need certain fillings or a root canal or whatever it is. Or if you have, great teeth and great hygiene, just a regular recall every 6 months. In Dubai, it works a little differently. I felt like it was a lot of educating families from my side, because a lot of the times that they came in and I wanted to take x-rays, the usual response that I would get is, but why? I'm not in pain. So that was a whole different world for me, because I had to sit down and explain, okay, well, we take x-rays because if a cavity is starting between your teeth, I'm not going to be able to see it in your mouth unless it's a massive cavity. And at that point, it might be too late to fix it. So dentistry is heading towards a preventative approach where we want to try and, avoid massive treatments, but just maintain really good hygiene, regular recalls with your dentist. So if there is any issues, we catch them really early. The earlier you catch issues, the easier the fix is. I think that applies to most things in life, and it does in dentistry as well. So this picture on the left side, it's again, just talking about aesthetics. This patient, if you see the upper front two teeth, he had a fall and he broke his front tooth. And that happened about 10 years before he came to me. At that time, the dentist that he went to had kind of glued on that part back with a dental glue, and that is something that we often do. But commonly, a few years later, after your tooth has had any trauma, it goes non-vital, or the nerve inside the tooth dies, and that tooth gets a darker color, which is what you can see. So he needed some root canal treatments to clean out the nerve. The canal, or the root canal of the tooth, houses the nerve. So we had to clean that out, and then we gave him some white crowns, and you can see how natural that looks. At the bottom, if you notice, his teeth, the gums look kind of red and inflamed, and in the bottom two central teeth, they're actually elongated compared to the ones next to it. So we did a little gum graft as well to cover it and make it look even. So this is more of an aesthetic change, and something like this, if you can only imagine the difference it can make to somebody's smile and confidence, because if you're walking around all day, having a gray tooth right in the front, it makes you conscious, it affects your confidence. So it's pretty fulfilling when you can give somebody a new smile and, just impact their lives in the smallest possible way, which it always goes a long way. All right, we'll go to the next slide. Like I said, I was doing a lot of educating and oral hygiene awareness. So I went to dental schools, spoke to parents, pregnant mom associations. And here I'm at a school in Dubai just talking to children about oral hygiene, why it's important to brush your teeth twice a day, and what is flossing, and what kind of foods are good for your teeth, and what kind of foods you should avoid. So just a lot of awareness that I did. And I think that as pre-dental students, if you find any opportunities to work alongside a dentist, any volunteer opportunities, go help them when they're doing any kind of campaigns like this. I did something in San Francisco. It's called Project Homeless Connect. At that time, I wasn't licensed to practice here in the United States, so I just volunteered online, and all I did was check blood pressure for the patients, but it's something that I included in my application to dental school. So any volunteer opportunities that you get which show your dedication, towards the field in general, towards helping people, I think that's something, it gives you perspective in life as well. And I think it shows the dental schools that this is something that you are pretty passionate about, and you want to help people in any way that you can. All right, let's move to the next slide. So again, this is just a simple, this patient, bit into something hard, and you can see that they happen to chip a front tooth. And then we did a simple white filling. Something like this doesn't even require any numbing or anesthetic. It takes just a few minutes, and you can tell what a big impact a small white filling can make. Now, when we're doing front teeth fillings, shade matching is extremely important. We want to make sure that the color of the filling that you're doing will match the exact shade of the tooth, because you don't want something to look slightly darker or lighter and be very evident and in your face. We do have certain shade match guides that help us. So before we start, we'll usually check the color of the tooth. Then we'll, the tooth colors are kind of divided into A1, A2, A3. Then once we've figured out which color the tooth is, we have corresponding filling materials in those shades, so we can actually fix it, and it gives a pretty nice result. All right, let's move to the next one. And this is something that's very popular these days. There's so many ways to whiten your teeth. We did in-office whitening, where the patient walks in. We apply, whitening gel. There's so many brands out there, whether it's Zoom whitening, Flash whitening, there's so many brand names, but it's usually about an hour-long procedure. Before starting, we'll protect the gums, because that gel can be pretty, intense, and it can burn your gums. So you have to make sure the gums are protected, and the gel only goes on the teeth. And then we activate it with an LED light, which, usually will cause that gel to whiten the teeth. A lot of the times there can be sensitivity associated with whitening, but that's something you always have to warn your patient. And I always like to say beauty is pain. There's a reason why we wear high heels, and I don't like to lie to patients and say, hey, this is not going to hurt at all. Whitening does cause sensitivity in some people. It may not for everybody. I know that when I had whitening done by my colleague, I was okay right till the end. And then the last 5 minutes of the treatment, I felt like a little zing of sensitivity. So that's normal. So that's one kind of whitening. The other kind of whitening is when the dentist will give you custom made trays that fit your teeth exactly. And then we give you a whitening gel that you can wear at night. And then the third is just in office, over the counter whitening products. You'll find Crest White Strips. Those tend to work pretty well too. The disadvantage with that, especially if you have really sensitive teeth, there are certain areas that you want to avoid because the gel, like I said, it's very potent and it can cause severe sensitivity. Also, that strip is not made to fit your teeth perfectly. So it also kind of sometimes goes slightly onto your gums. And again, it can be harmful for your gums. So there's always advantages and disadvantages. But I always say if you are interested in whitening, you can always start with the whitening strip, see how you feel. And then the best result you're going to get is usually with the in-office whitening. All right, we can move to the next slide. All right, this is something that's very dear to my heart. I went to Kenya I'm going to be back in a second because I have left something on and it's continuously beeping. I'll be back in just a second. All right, I apologize for that. I actually left my straightening iron on and that beep was driving me nuts. Okay, so Kenya. I went to Kenya in 2019. Honestly, this experience truly changed my life. I think it was at a point in my life where after practicing as a general dentist for a long time, I guess I just started to question a lot of, why dentistry? Do I love this? I felt disconnected. I wouldn't call it a midlife crisis, but I definitely felt like I needed to go back and just reconnect with why I fell in love with dentistry in the first place. I found this volunteer opportunity through World Health Dental Organization. They actually have a clinic in the Masai Mara, which is in the middle of absolutely nowhere, in the middle of the African savannah. We had a clinic which was surrounded by an electric fence because we had animals all around us. I remember one night, literally, I saw elephants right outside. And if you move to the next slide, I don't know, can you play the video? I don't know if it got transferred as a video.
I don't think so.
Or maybe it got transferred as a picture.
Yeah.
Okay, it's fine. So, I wanted to show you guys this first video. This patient was, I had just given him anesthetic. I was going to extract his tooth. And literally, I look outside the window and there's just deer everywhere. And I was like, wow, that is beautiful. Where in my life am I going to get a chance like this? And then the second picture, you can see that's the electrical wire, barbed fence, whatever, right outside the clinic. And there's just a herd of elephants outside. And we were told to stay within the clinic limits because it can be unsafe if you walk out unattended, because only with my local Maasai guide could I leave the premises because it's dangerous. Here it's interesting, but in Masai Mara, the most feared animal is actually the elephant and not the lion, because elephants get intimidated and they will basically crush a human, and they can really run at high speeds. And lions, actually, I saw so many lions, but they seemed very chilled out and not fazed by tourists at all. And then you can see the beautiful giraffe. So it was just such a unique experience. Again, this was a volunteer opportunity. If you ever get any chances like this, I urge you to take them up. You'll get many once you are in dental school, you'll get them as well, where I remember when I was in dental school, a bunch of dental students went to Guatemala. Somebody recently went to Palestine. You just have to keep looking. And there's tons in Kenya as well. So any opportunities that you can get, even as pre-dental students, right now with COVID, everything is different, I understand. But once things look better, these look phenomenal on your CV. And it's such a great conversation starter in your interviews as well. Even now, when I'm talking to any dentist, any doctors, the moment I mention, oh, I practiced in Kenya, that's it. That's all they want to hear about, because it's just such a unique opportunity to have, that I've been part of. All right, let's move. All right, this was actually a video of the clinic, but I don't think it's playing right now. So we'll have to skip that. It was actually a pretty well set up clinic in Kenya. It was funded and started by Loma Linda University in California. I had the fortune to treat all the village elders over there. How it works is there are little pockets of the village. Each pocket is called a manyata, and usually children are brought together by one village elder. They're not brought in individually by parents. Literally, a flock of children will walk in. Usually, here in the United States, a parent brings the child. We take consents, and only then do we start. Over there was no consent forms, so that made me a little nervous because I'm not used to that. But in that part of the world, a doctor is treated like, there was so much respect given to me that I didn't even know how to handle it. I remember I was there for Easter, and one of my assistants invited me to the church, and they actually asked me to give a speech. And I was like, oh my God, like, this is so humbling. Another thing you'll see in this picture of this lady here is the massive gap between their teeth. So this is called a midline diastema. That's something that you'll see very commonly in African culture. But as humans evolve, the shape of the skull has changed a lot. So one of the things that I found very interesting is a lot of the children, younger children, if they did happen to have, teeth that were close together, parents actually came to me and said, hey, he has extra teeth. He doesn't have the gap. Can you extract his tooth? And it was a lot of me educating, saying, no, that's not an extra tooth. That's, just the teeth happen to come together, and that's wonderful. But sadly, it's part of their culture. You have to respect the norms, because I was told a lot of the times, if they think especially if there's crowding of teeth, here we have braces and things like that. Over there, if there's crowding of teeth, they believe, it could be misfortune for them. And if you as the dentist will not perform treatment, they might do it at home without anesthesia. That can be pretty uncomfortable for the child. So it was, a lot of educating these village elders. But again, language is a barrier. So this was, it was an interesting take on dentistry compared to everything else that I've seen in the world. All right, we can move to the next slide. This was a cool opportunity. I volunteered in the northern part of India in a place called Ladakh. It was on the border of India and China. We went for a 3-week mission trip, again, providing dental care to the villages. And it was an insane opportunity because we got to meet the Dalai Lama. He wanted to thank us for our services. There was 40 of us dentists who went there together from all across the world. So there was an organization from the United States, from Europe and India that kind of joined hands to make this mission possible. A lot of them were actually the dental students as well. So very cool opportunities exist. It's going to give you, it makes you think about life very differently. You realize how fortunate you are when you often go to, these places providing dental care in the middle of nowhere. I remember I pulled out a tooth on a little 4-year-old child. And usually when they're here, I'll say, oh, Mom, for today, you can give them a popsicle or something cold, and that's okay. Over there, they've never heard of an ice cream. And I didn't even know what to say, because I would try to give my usual instructions that I give here. I was practicing in Chicago, so I would give my usual instructions that I would give in Chicago, and those don't apply there because they've never had access to those things. They don't even know what half these things are, because these are villages which have barely any access to electricity. So, it makes you look at life very differently. All right, let's go to the next slide. And then dentistry in the United States. So here, it's probably state-of-the-art dentistry, very advanced. This is where you are, and you will learn from the best. There's a reason why after India, I came here, and after moving to Dubai, still came back here. Dental education, in my opinion, is the best in the United States. In the first picture on the upper left side, you can see that a patient had a tooth that was really broken down, and it was extracted. So the picture that you can see on, right after is a tooth that has been removed. And then you can also see the black filling. It looks like a cavity, but it's probably a silver filling, has been replaced by a white filling. The picture on the upper right, it's a patient who has no teeth, top and bottom. In the first picture, it looks like he has teeth at the bottom, but it's actually a denture. And on top, you can see those little screws. Those are implants, because now we have implant-supported dentures. So it almost kind of fits like a clip into the mouth, rather than, a lot of the times, I don't know if you've seen that funny random Facebook, TikTok video when an old lady's blowing out the candles and her dentures come in her hand. Dentures can get loose, but this is a cool way that has come, it's been around for quite a few years now. It doesn't work for every patient because you need enough bone in your mouth to be able to get implants, but it's a wonderful way to replace missing teeth. And then at the bottom, your bread and butter dentistry, you're going to do a lot of prophies, which is a cleaning. So you can see there's a lot of tartar buildup on the left picture, and then on the right, it's a nice, cleaned teeth. They're cleaned and polished, and usually recommend all your patients to get it every 6 months. A lot of them who have gum and bone disease, it might even be every 3 to 4 months, depending on the patient. All right, let's move on. And again, not all of these are my pictures. Some of these are stock pictures from the internet. Some of them are mine. So I just wanted to give you an overall idea. Here on top, you'll see a before picture. The teeth look pretty healthy in my opinion, but a lot of the times patients are not happy with their smile. So on the upper right side, this patient has got veneers. Veneers is almost like a thin shell of porcelain that covers your tooth. It's eggshell thin. So it's a really thin, it covers and it changes the shape, color, form of your tooth. If you have any fractures of the front teeth, this is a great way to replace it. And just aesthetically speaking, you can see how stunning that result is. And then on the bottom, this patient, she just had her upper 4 teeth missing. She couldn't afford implants. She couldn't afford a bridge when it was applicable. So she came in, and what we gave her was something called a flipper, which is essentially a short-term solution where you replace a few teeth with, pink acrylic material, and then you have teeth. You clip them on with a little silver wire. You can see that on her teeth. And then when the lip is down, it actually tends to look pretty natural. And these come out, I kind of tend to call them party teeth because they come out when you're eating or come out at night. They're partial dentures because they're not meant for people who've lost all their teeth, but lost a few of their teeth. All right, we can move on. So here, once you are a general dentist, there are so many fields that you can decide to do a residency in. I'll go over a couple of these. Endodontics is root canals, oral and maxillofacial, pathology, radiology, and surgery. Surgery is basically, it can be 4 or 6 years after dental school, where you're going to be the oral surgeon who is doing very extensive procedures involving the jaws, third molar impacted teeth, facial fractures, accidents. You deal with a lot more than just dentistry. Not something that I was interested in at all, but I have a lot of respect for oral surgeons because that is not an easy field to get into. And I think there's a certain personality type who's meant for oral surgery. We have orthodontics, which is braces. We have pediatric dentistry, which is where my heart lies, and I'd love to talk to you more about it. Periodontics, which is a lot of gum treatment, implants, gum surgeries, prosthodontics, which is regarding replacement of missing teeth. So many fields that you can decide to go into, or you can practice as a general dentist, and majority of dentists do, and I did as well. But in my case, I decided to go back to pediatric dentistry. So let's move on. All right, so by definition, pediatric dentistry is an age-defined specialty, usually 0 to 18 years of age. It provides primary, comprehensive, preventative, therapeutic oral health for infants and children through adolescence, and also includes those with special needs. These are some of my patients in Dubai. We usually start seeing children around the age of 1 is when we recommend their first dental appointment. Here's another set of siblings who I saw. We always, if the children do well, we always want to reward them and let them know that they've done well. And if they don't do well, obviously sometimes they're just screaming bloody murder in your chair. And sometimes, they're petrified, and children will be scared. As a general dentist, it's our job to kind of help alleviate those fears, rebuild that trust. And that's how, a general dentist can treat children too. And I did for a long time. But the moment the child screamed, I would refer them to the specialist, because then it can get very hard to treat a screaming kid, because you can imagine if there's a kid throwing a fit on your dental chair, and throwing his hands and, or his or her hands and feet, and you're trying to drill into their teeth, that's probably not a very safe thing to do. All right, let's move to the next slide. So usually I said, the first appointment is around the age of 1. This is when we're establishing something called a dental home. This first appointment is usually a very quick appointment. It's more so just to make sure that their teeth are developing okay. We usually count their teeth, check for any cavities, and then we apply fluoride on their teeth. Now, you might wonder, a 1-year-old child, how is it possible to get cavities? And you'll be shocked. We see it so very often because a lot of the times when children are being put to sleep with a bottle of milk at night, that milk is basically sugar and carbs on their teeth sitting throughout the night, and those can cause cavities very quickly. And in fact, there's a name for that cavity. It's called baby bottle tooth decay. So it's a lot for educating the parents on how to take care of their teeth, of their child's teeth, and also what kind of foods cause cavities. I always like to tell parents, they might say, oh, he loves brushing his teeth, or she loves, she's got her brush in her hand all day. And I always ask, like, does she brush on her own? And usually the parents say, yeah, she's so good. She just wants to brush all day. But then you have to remind them that children that age don't have the manual dexterity to really go in there and clean their teeth. So until the age of 6 or 7, or sometimes even 8, you have to go in after as parents and clean their teeth. So usually I'll say, if they're old enough to, tie their shoelaces, at that point, they're old enough to brush their teeth. Otherwise, all they're really doing is they love the new toothpaste flavor, and they're just really biting down on the toothbrush. All right, let's go to the next slide. So, this is kind of sad to see. A lot of the times, this is something that happened from bottle feeding. The child was going to bed with a bottle, and he developed cavities in all the front teeth. We applied something called silver diamine fluoride. What this does is it stops the cavity from growing bigger, especially when the child is very young and it's hard for us to really do fillings at that time. So this will help kind of arrest the cavity, but it also turns the tooth a dark black color. And as you can see, this can really affect the self-esteem of a child if that's what their smile looks like. But that's where we come in. And then let's move to the next picture. This is the same child. Sorry, the picture is rotated here, but that's once we put white crowns on those teeth. So you can see how natural those look, how beautiful those look, and how happy the parents are, because they're like, oh my God, the yearbook photos, they're gonna look so bad. That's, as a parent, these are your worries. And as a child, you're gonna get ridiculed and bullied if you have, black teeth right in the front. It's true, but that's something that really affects your confidence level. So in pediatric dentistry, this is something that we can really, the joy you get from impacting a child's life, I don't think there's anything quite like it. All right, we can move to the next slide. All right, so how is, pediatric dentistry different from adult or general dentistry? So I think the way we talk to children really can affect the child's temperament. A child is not a mini adult. You can't speak to them the same way. One thing I always say is never lie to the child, because the moment the child knows that you're lying, you've lost the child, or you've lost their confidence or their trust. So there are ways to kind of get around it. We use something called tell, show, do. So if I'm going to clean a child's teeth, I'll say, hey, this is my fancy electric toothbrush, and why don't I show what it sounds like? And it's usually just a little rotating, it kind of feels like an electric brush. So I'll show it to them on my finger first, and then I'll say, oh, do you want me to show it, on mom's finger? Then I'll show it on mom's finger. And then they're still kind of like, I don't know. And then I'll say, well, why don't I show it to you on your finger? Once they've kind of figured out that, okay, she's kind of nice, it doesn't look like she's going to hurt me, that's when I go in there and put it inside their mouth so I can treat them. Similarly, when we're giving them local anesthesia, if they're going to see the needle, they are going to freak out. So there are ways that you can get around it. So we usually apply a topical gel, which numbs the gum before we insert the needle. So at that point, I'll say something like, ooh, this is my frozen jelly. Do you like Elsa? Oh my God, Anna's my favorite. Like, just keep distracting them. Put that jelly, and then they'll say, oh, that feels funny. It feels like, I'm like, yeah, your gum's getting frozen. Isn't that so cool? And then when I'm actually going to go in with the anesthetic, I lift their chin really high, and then we give them laughing gas that, it's a big thing that sits on the nose. So then they really can't see what's coming underneath the nose. And that's when I go in, very effortlessly and say, oh, you know what? There's too much of that frozen jelly. I'm going to wash it off with some really cold water, but I need you to take some nice deep breaths so we can warm it up. Now, those nice deep breaths is the nitrous oxide or the laughing gas that completely makes them kind of like hazy and, makes them giggly and feel funny. And so essentially you've distracted them so much that they don't even realize that a needle's gone in their mouth, and that's it. Suddenly the rest of the mouth is numb and you can get the work done effectively. If you have to drill, they don't feel anything. So it's a lot about how you talk to the child. Again, I don't lie to children. It's just about how you phrase it. I don't know if any of you have had a rubber dam place. When you're getting fillings done on a root canal, oftentimes they'll place this massive sheet on your teeth to separate it from your gums. So when I'm putting that on a child, if I ever have to, I'll say, ooh, this is a raincoat for your tooth, because I want to make sure that your spit doesn't get on it. And then the child is always like, ooh, that's cool. And then sometimes I'll show them, a mirror saying, oh my God, look how cool you look. So, and then if they do really well, we always have a gift box. I'll go give them a prize. You'll keep bribing them with stickers when each time they've accomplished something. When they were scared of step number 1 and then they got through step 1, you'll say, oh, you just earned a sticker. When they got through step 2, oh my God, I think you won a prize. So, you just want to keep encouraging positive behavior. And if there's negative behavior, you say, okay, well, I guess you lost a sticker now, because then they realize this is not okay. And that's just how you learn to behavior manage children. All right, we can move to the next slide. All right, this is just, unfortunate. On the picture on the left, you'll see this child, the little massive, bubble or bump that you're seeing near the tooth. It's an abscess. It's a tooth that had a big cavity that wasn't treated on time. A lot of the times when children are not brought in regularly, cavities don't always cause pain until they get to the point that they're large enough to cause an infection in the bone. Now, if that happens, if it's an abscess like this, 9 out of 10 times that tooth needs to be extracted. Now, on a child, when you extract a tooth, you might affect how that permanent tooth comes in, because there's a permanent tooth right underneath it. But when you extracted a tooth earlier, then it should fall out on its own. The 2 teeth on either side will kind of want to move and close that space. And if that happens, the permanent tooth under doesn't have the space to come out. And that's when you start the saga of getting braces and things like that. So again, regular dental care for children, for adults, very important. A procedure that we do very commonly here on the right side, you can see it's a silver crown. Usually on adults, we'll use white crowns. On children, these are called stainless steel crowns, very, very commonly used. And this is probably the best way to treat really big cavities in children. You also do get white crowns for kids these days. Those tend to be more aggressive because we have to remove a lot of healthy tooth structure to be able to fit those, whereas these work pretty well without removing too much of the healthy tooth structure. We only have to remove the diseased tooth structure. All right, let's move to the next slide. I think we're coming to the end. Yep, we are. So that's me. I always work with loupes. I feel blind without them. This is 2.5 magnification. It really helps me see teeth. Literally, baby teeth are that tiny. When I'm looking through my loupes, they're like the size of a watermelon. So I can really get in there, make sure I've cleaned out everything, not missed out any part of the cavity. That's my Instagram account. Feel free to reach out to me anytime if you have any questions about dentistry, about pediatric dentistry, about practicing in different countries, how to get licenses in different countries, or you can email me. I'd love to hear from you guys. And if you have any questions, I will, I think I can have access to them now, and I'd love to answer them.
All right, awesome. We'll ask some questions from the chat and then also some other questions. So the first one was about Kenya. Did you end up taking a lot of teeth out in Kenya to follow the social norms?
Yes. Well, yes and no. Not so much to follow the social norms. I spoke to a lot of parents. I remember this one kiddo, the permanent canine on one side had already been extracted. I'm sure the dentist, whoever did it, was probably at that point where the parent was forcing them. So they came back to me for the other side. And now normally I don't like extracting the permanent canines because that's probably one of the most important teeth in your mouth. But you also want to have some symmetry in the face, in which case I did have to remove it. A lot of the other times I had my assistants translating for me. So I try to avoid it, but I did so many extractions in Kenya because over there was no access to doing fancy implants. We didn't have a lab to make crowns and bridges and things like that. And if a tooth was really severely broken down, I had to extract them. So I remember in 2 weeks, I did over 150 extractions. When a tooth is not very badly broken down, you can try and save it with a root canal. And I did save a few teeth with root canals as much as I could, because I love, saving teeth. I do not want to pull it if I can avoid it. The philosophy, I think I like to follow, if it's an older patient, I think the question you should ask yourself is, would you do this if it was your mom or dad or your grandfather or grandmother? If it's a child, would you want this child to be treated this way if it was your child? I think this is the baseline that helps if you're always going to be in two minds. There's no black and white dentistry. There's always so many ways to treat the same patient. If you're in doubt, well, it's great to maybe call a colleague, or if you have a mentor around you or your faculty, or just a colleague, just be like, hey, what would you do? It's always good to bounce ideas off somebody. And if you're still in doubt, and if it's ever like I don't know, always ask yourself that question, and that will always give you the right answer.
All right. And then another question was about pediatric dentistry. Do you think you have to have a love for kids to be a pediatric dentist?
Absolutely. I think that majority of general dentists hate working with kids. Literally all my friends think I'm crazy. They're like, why would you want to be a pediatric dentist? Whereas all the ones who are pediatric dentists, I think we all have the same level of crazy. There's a certain personality type that, I love having. Kids are so funny. They say the weirdest stuff. And then you as a provider can be weird with them too. And we just have the most fun conversations in clinic. Sometimes they don't even have to make sense. We just keep blabbing and blabbing. Once, I remember this child, I said, ooh, I'm going to give you the sleepy juice that's going to put your tooth to sleep. And literally his response was like, is my tooth going to have dreams? And I was like, wow, that is an excellent question. You know what? Why don't you tell me? And, so another thing that helped me is, I don't know if you guys have heard about improv and stand-up, but I did a lot of improv classes at the Second City while I was in Chicago, which just teaches you everything kind of to speak on the spot. And I feel like children are the best improvisers. They don't speak before. They don't think before they speak. They have no filter. I enjoy my appointments the most. And I'm not going to say everything is easy. When you have that screaming, crying child kicking around, that gets difficult. And that's when your behavior management is really important. Or you have options like treating them under different levels of sedation or under general anesthesia. And it's very rewarding to be able to get a child out of pain or return a child's confidence. So, yeah.
All right. And then another question was about residency. Why was Temple in your residency choices?
So when I was applying to residencies, they're divided into university-based programs and hospital-based programs. University-based programs tend to have a more heavy focus on research, and you do see a lot of patients, but the clinical aspect or the patient seeing aspect is a lot lesser. In a hospital-based program, sometimes they say they work you like a dog, but the sheer volume of patients that you're seeing, the experience that you're getting, I think there is no comparison for me. And because I had worked as a general dentist for so many years, I did not want to kind of slow down. And research is great. It's meant for people who are really into it. I do like the research aspect of things. And even in my residency, we are doing research. We're actually working on a COVID project right now. But for me, it was just being really busy and seeing a large number of cases and learning from it. And that's what the real world looks like. That's what private practice is going to look like. So it was the closest to private practice, and you were learning from some of the best faculty. When I interviewed, I did I would also say do as many externships while you're in dental school if you do happen to want to specialize, because doing externships tells the residency program that you're really interested in them, where you spend, sometimes one day, sometimes 2 weeks just shadowing in that. So I shadowed at Temple, and I just felt like it was the perfect fit for me. The people are so nice. So it was by far my top choice.
Awesome. And then another question pertaining to your travel plans. Do you plan to, again, go on another trip, like another dental trip in the future?
In the future, 100%. When, I don't know. I think some of my happiest times have been when I've been on these outreach dental trips. So I would absolutely go back to Kenya too, but I do want to try and see as many places and try and treat in as many remote areas as possible. But right now with COVID, of course, that's limited. But I'll keep posting about it on my Instagram page if I ever decide to go somewhere else. But I think once a year is a good philosophy to have for me, to want to go and provide voluntary service.
Awesome. And then our last question for you is, what is your favorite procedure?
This is weird for pediatric dentists, but I love extractions. I just feel like um, there's like a sense of, I had this little joke with my assistant when I worked at a hospital in Illinois. In the beginning, extractions are hard, and then as you get better, once you get the right technique, sometimes it can be really easy, and there's still some that are extremely difficult. But the pleasure I get out of removing it really quick, and the patient sometimes doesn't even know. Sometimes, I'll say, "Oh, I'm going to get started," and boom, in like 5 seconds when it's out. And then I love seeing the patient's reaction when I say, "Oh, it's out." They're like, "What? Wait, are you serious? What do you mean it's out? I didn't even feel anything." And that is the biggest compliment for me. So for children, for example, we get a lot of teenagers coming in who need to get their premolars extracted when they're going to get braces. And right now, that's one of my favorite procedures because it's just such an easy procedure. And I love when kids have no idea that it already happened. And then they just look at you like, whoa, did you just manage to do that without me even realizing? And that's a pretty cool feeling.
All right, awesome. Thank you so much, Dr. Kotak, for this
Well,
amazing session today. We really appreciate you.
of course. Thank you for having me.